COVID-19?
COVID-19 is mostly, what you should know is that it is a virus related to the corona part of a cell, and it started in 2019, so we get the 19 from there.
Is it like other viruses?
Yes, because COVID-19, like other viruses, are airborne, and it travels, so it's basically affecting your respiratory system. It'll start from maybe coming through your nose or mouth, and it'll go down into your lungs.
Why do we get sick?
So initially we'll be healthy and feeling well because we don't have a virus illness or flu, but once the virus gets into your lungs, it builds up. It'll build up gradually over time, and that will make you feel sick. You won't feel that sick initially, you'll feel quite okay, but it will start to grow and grow and grow, and once it comes to a certain stage, you will definitely feel sick, and then it just keeps going worse if you don't treat it.
What do people do when they get sick?
So you will run through a number of stages. Let's say feeling sick here. You're feeling sick, but you're okay, you still do the normal things that you do. That's just the initial stages, maybe a slight cough or irritation in your lung, in your throat. But afterwards you realize that you are sick. And then what you do is maybe you gargle, have vitamin C or steam occasionally. You try different things. Different things. And then after that, obviously, you might need to see a doctor. Take medication. If this still gets worse, you might get admitted to the hospital. And at some stage, you might need oxygen. And then if you still don't recover and your condition worsens, you might be on a ventilator. So generally, hopefully you do not need to go to this stage, and you can recover. Well, in general, most people recover in maybe 1, 2 or 3 stages, above 80%, but there are few who might go down to this condition. So what we need to try to avoid is going down to 4 or 5. Hopefully we can see a doctor and the medication we get is adequate.
What happens if the sickness gets worse?
Yes, so like I said, we do need to see a doctor. We might be hospitalized if it continues, and depending on your condition, at present what happens is, even giving the oxygen or being on a ventilator is decided depending on the condition of the patient. Always go by medical advice. Ask your doctor if you're not sure. Don't do anything unhealthy, but if it is okay to do so, just do breathing. Increase your breathing, increase the amount of oxygen in your lungs, especially if you're feeling sick, and hopefully you don't need to get hospitalized, and you hopefully won't be on a ventilator. So is that good?
Yep.
Right, I might have taken a little more than 5 minutes, but I hope it's useful. We can do a few more videos, especially at least one more. I can explain further, but for now I think that's good. So just remember, just breathe. Oh yes, you definitely need to stay at home, so maintain social distancing, talk to your family members, maybe watch TV, and be safe. And also, like I said, always do this. So if your lungs are operating efficiently, more efficiently than they are, and you have more oxygen in your lungs, chances of you getting sick and the virus growing will be hopefully less. The point is, if you prevent the virus from growing in your lungs, you might reduce the chances of you or a person coughing or sneezing. Now, it is through coughing and sneezing mostly that the virus will spread. You can have a virus in your lungs, but if it does not go out of your lungs, not from your stomach, not like from what you eat or something, it is in your lungs and can be in your throat. If you can be healthy and have more oxygen and reduce the amount of virus growth in your lungs, the need for you to cough and sneeze hopefully is less, and then that will help reduce the spread, and hopefully you don't need to cough and sneeze. So if you can do that, you're helping the prevention of the virus spread. So social distance and everything is based on the fact that someone else can have a virus and that might spread to you or someone else, and therefore you need to keep a distance. But also remember, if you can reduce the amount of virus growth, the less the others will be coughing and sneezing, or the less chances of somebody else being infected, and also the lower the transmission, hopefully, of the virus through air.
Thank you.
You're welcome.